Okay, pet parents, let's learn you a thing or two about IVDD, or intervertebral disc disease. Now, to kick things off, as a bit of a basic definition, when you hear the term spine, I want you to think of three main components. There's the spinal cord itself, then there are the bones or the vertebrae that surround and protect the spinal cord, and then in between those vertebrae, there are these soft, squishy discs called intervertebral discs. And I want you to think of those discs as a jelly donut, where you have the donut on the outside, and then on the inside at the center, there's a whole bunch of goopy material.
Oh, what is that? Is that raspberry goop? Oh, it's delicious.
Essentially what's happening with IVDD is that goopy material has either ruptured out of the donut and is pushing on or compressing the spinal cord itself, or the goopy material is causing the donut to bulge into the spinal cord. And once the spinal cord is compressed, that's when we start seeing clinical signs. The clinical signs of IVDD are widely variable and can range from simple neck or back pain to your pet not being able to move or feel one or all four of their limbs. The severity of the clinical signs depends on how much of the spinal cord is being compressed. If you think of the inside of this glass as the spinal cord and we bring back that tasty jelly donut, as the bulging disc worsens, you can start to see less and less of the spinal cord, or more of it becomes compressed. That's what determines the severity of the clinical signs that we see. This condition is much more prevalent in chondrodystrophic dogs, or long and very short dogs, with Dachshunds being the poster children of this condition. And even though x-rays can give us indications that this disease is going on, the only way to truly diagnose it is with either a CT scan or an MRI scan. How we treat this condition depends on the clinical signs your pet is showing, but we have one of two different ways we can treat it. The first way is medically, with medications for pain and inflammation and extremely strict activity restriction. And the second way is surgically, meaning we physically go in and remove the compression on the spinal cord by scooping out that goopy material.
Raspberry goop's the best.